Hello friends, this is Dr. Anuradha Roy from the Department of Prasuti Tantra, Faculty of Ayurveda, Banaras Hindu University, Varanasi. So friends, today I am going to discuss on a topic from Prasuti Tantra and Stree Rog on Uttarvasti. Uttarvasti is one of the potential treatment modality in the field of women healthcare, and so it's become very important to look for all the core research area points which are needed to be sorted off in today's purview so as to scientifically validate all the principles and practical applicability of the researchers in Uttarvasti. So today in this lecture, we will be highlighting a few points starting from the concept of Uttarvasti, areas of research in Uttarvasti, the pharmacological study, validation of the research, summary at the last. So to start with, Uttarvasti defines उत्तर मार्ग दीयमानतया किंवा श्रेष्ठ गुणतया उत्तरवस्ति as per Charak, and स निरुहात उत्तरम उत्तरेण वा मार्गेण दीयतः इत्य उत्तरवस्ति. That means as the procedure is given or injected through the vaginal passage which is in the upper position, then the routine position of Gudabasti. That's why it is called Uttarvasti. And secondly, as Niruhavasti is given prior to Uttarvasti, and also it has a superiority in its qualities and efficacy, it is termed as Uttarvasti. Now, Uttarvasti yantra can be of Anuvasan Vasti type and Niruhavasti type, as the materials which are being used for Uttarvasti can be of Snehana for the purpose of Snehan, maybe in terms of the Anuvasan Vasti, or it can be for the Niruha type, that is the Shodhana Vasti. Parts of Uttarvasti yantra can be Dravya Grahanartha Vasti Putaka and Aushadhi Praveshartha Vasti Name. Coming to benefits of Uttarvasti, due to suppression of Vayu, rather normalization of the Vayu or the Var by the administration of Uttarvasti, the Yoni retains the Garbhashaya quickly. That means a female who underwent Uttarvasti or getting a treatment of Uttarvasti and having a subfertility are more likely to get a conception early than the other. Also the Yoni Bhrangsha, Yoni Shul, Ashrigdar, Artavanash, Kashtartha, other Yoni Vyapads are the field of benefits of Uttarvasti. Dose of Uttarvasti is mentioned in the classics as 1 prashrit. Also it is quoted that the strength of the disease, whether it is mild, moderate, or a relatively severe, as well as the condition of the patient, it should be under the jurisdiction of the treating physician or the consultant, and has been clearly quoted as the Buddhi Vikalpita, that is on the consensus and the decision of the consultant or the treating physician. If the basti is given for the purpose of Shodhana, then undoubtedly it should be Dviguna, that is double, that means 2 prasrita. Practically when we prefer giving 3 to 5 ml of the drug for it. Now here a point to be researched and standardized is, let's standardize the doses of Uttarvasti on the basis of Prakriti, on the basis of dosha predominance in that particular Vyadhi for which we are giving, dimension of Uttarvasti, and the purpose of Uttarvasti for which we are giving the procedure. So it will be a good study if we can standardize the dose of Uttarvasti depending on these following criteria on Uttarvasti. Time of Uttarvasti in the text is given just after giving 2 or 3 Asthapan Vasti. For Shodhana, Uttarvasti should be administered during Artavakal or Ritukal, as during this period the yoni or the garbhashay remains or devoid of any avarana. Also, the yoni mukha is open. Thus, it accepts the sneha very properly and very acquaintedly, so that the potency and efficacy is much higher. Practically, when used, it is administered post-menstruation on the day of 5th, 6th or 7th, or just after cessation of menstruation. It is repeated for 3 cycles consecutively, or it can be given for 3 days with a gap of 3 days, and it can be repeated for again 3 days. Now here the point of research may be the purpose-wise standardization, the time of Uttarvasti administration. For example, if a physician is administering Uttarvasti for Lekhana purpose, or for Shodhana purpose, or for simply oleation or Snehan purpose, what should be the appropriate time of administering Uttarvasti should be sought of and should be standardized. Now all these things are only on single point so as to quality improvement or the quality treatment of Uttarvasti. Now this is my concept that purpose of Uttarvasti can be categorized as Shodhana, Tarpana and Lekhan. Research pairs can be categorized under 3 headings. These are procedure-wise, drug-wise and technology-wise. We can have a research protocol and we can standardize. Under the category of procedure, there can be skill development. Under drug, there can be various modification and implementation of various drug delivery systems can be included in that. And technology-wise innovation and all modern technologies of basic sciences can be implemented so as to standardize and so as to justify our efficacy of Uttarvasti. Now coming to procedures, all the following points can be taken as a parameters to prepare an SOP or standard operative procedure so that a common SOPs be followed overall, all over wherever we are using it. So these points may be pre-operative procedures, place for Uttarvasti administration, required instruments and its sterilization, day of Uttarvasti administration, route of administration, position of drug administration, amount of drug to be administered, post-procedure activities, position and time, post-procedure effect and its management. Lastly, the complication and its management. All these can be researched of and can have a SOP to be framed and standardized. Time of Uttarvasti can again be categorized under Shodhan, Tarpan and Lekhana. Now coming to drug, when we talk about drug administration, we can have the advanced drug delivery system under which we can use the liposomal drug delivery system or nanotechnology or even the sustained release technology in our Uttarvasti drugs. Then the state of drug. For example, if I'm using a Uttarvasti drug, so in what form should I use? Whether it should be warm, it should be cold, or it should be normal temperature. This is again should be standardized, that in which condition it plays the maximum optimal role in absorption of the material. Now this is a paper on Sneha Kalpana or the Sneha Pak vis-a-vis liposomal therapy. It shows that the liposomal system of drug delivery is a new invention in the conventional system of medicine. And this system is also covering a high degree of objective of the therapeutics at different targets very successfully. And it is an advanced dosage form in which the nanoparticles comprising the lipid bilayer membrane surrounding an aqueous interior are formed. The amphiphilic molecules which are used for the preparation of these compounds have similarities with the biological membranes and have been used for improving the efficacy and safety of different drugs. It also shows that it has a compound that can be located either in the aqueous spaces if it is water soluble and in the lipid membrane if it is lipid soluble. So in case of the liposomal drug delivery system, tremendous work is going on in terms of sustained and controlled release drug forms, but in the field of oral and parenteral administration. So why not to think about this drug delivery system in our concept of Uttarvasti to again get the optimal drug action. Also, it is biodegradable and having a suitable shape and size so as to accommodate the wide variety of substances and liposomes that are fulfilling all the parameters, and therefore it can have a controlled and targeted drug delivery system so that once it is given through the vagina, once it is given into the uterus, so it will have a target uterus or the endometrial oriented action on that. So liposomes are found to be suitable for localization of topically applied drugs at or near the site of application due to the fact that they are also have shown to act slowly and have a slow releasing vehicle. Thus, it may be assumed that the Sneha Pak may have the same structure and function as that of the liposomes, or in other words, these liposomes may be termed as a modified form of traditional Sneha Kalpana. So the thing is that this drug delivery system may be implemented, rather should be tried to be implemented in our Uttarvasti drug delivery system so as to try and to test its efficacy on that. Coming to technologies, we can use various technologies in Uttarvasti also, like we know Uttarvasti is a blind method. Here we can use an ultrasound guided Uttarvasti so that we can actually find out the target areas of the site where it is going and have an action on that. It has a great role in artificial reproductive techniques also. And lastly, the instruments which are being used for Uttarvasti also need to be researched of for its better and patient-friendly utility in that. Hysteroscopy is again a instrumentation where it can be visualized and the Uttarvasti can be applied for, as we may correlate. Hysteroscopy is nothing but a modification of Yoni Vranekshana Yantra or Yoni Vrana Prakshalana Abhyanga Yantra. So just visualize and administer. So that will be more target oriented, safe and user friendly. So these are all the technologies which will be used in Uttarvasti so as to validate scientifically our claims about the Uttarvasti. Now, we can also augment a synthetic dye on our Uttarvasti drugs which are being used, and we can get a graph, or we can have a scanned photograph of exactly the site of its administration with respective pressure when applied for. These are a few papers which assess the endometrial receptibility on the infertile women who are undergoing IUI, that is intrauterine insemination, which shows that endometrial receptibility is very much important for the pregnancy to occur. Also, endometrial movement are important or is directly proportional to the incidence of pregnancy. The summary at the conclusion of these two papers shows that pregnancy is not related to the only endometrial thickness or the endometrial volume, but significantly related to the endometrial receptibility and endometrial movements, which are associated with the number of contractions, strong movements, particularly cervicofundal direction, and hypoechoic changes which are being occurred before the IUI being planned. So these parameters, also this third paper which signifies that perfusion of GCSF. GCSF is a granulocyte colony stimulating factor which is being involved in improving the endometrium and again directly proportionate to the incidence of pregnancy. So these are few parameters which can be taken to justify our efforts and our claims for Uttar Basti. These parameters can be used to assess our effect of Uttar Basti even in some subfertility and infertile couples. Now, contribution of Uttar Basti in ART are a lot, but in majority it enhances the endometrial thickness and endometrial receptibility, and which has a very easy assessment criteria just to go for ATVS, transvaginal sonography, and know the endometrial thickness before administration of Uttar Basti and after administration of Uttar Basti. The second is priming up of the endometrium before artificial reproductive techniques like ART, like IVF, IUI, and other things. So this priming up of the endometrium, if we can scientifically validate with the help of these parameters like endometrial receptibility, endometrial thickness, GCSF, endometrial movement, which may be enhanced after administration of Uttar Basti, we can validate our claims that Uttar Basti do have a great role in subfertility or in subfertility cases, or it's directly proportionate to the incidence of pregnancy in the classics which has been told. So coming to instruments, equipments for the drug administration, when practically we go for a administration, the first point is the equipment or the instrument to be used. So it can be an IUI cannula or an infant feeding tube or can be a catheter. But again, it has to be standardized so that we can have a standard protocol of administering Uttar Basti in a scientific way. Uttar Basti Yantra Putak is again considered in our classics to be Mridu and Laghu, and dimension of Basti Netra is described as it should be. It is also termed as the Pushpa Netra, and it has to be formed by either Swarna or Rajat, Tamra. It should be of Gopacha, Samstita, and Sharshapa Chidra, and its dimension should be Dasha Angula. So circumference of this Pushpa Netra or the intrauterine instrument nozzle and the Karnika as mentioned as per the age and the passage for both the Yoni Marg and the Mutra Marg. Now there are various doshas which has been mentioned again related to Uttar Basti. It can be categorized or it has been categorized as Basti Data doshas, Basti Netra dosha, and Basti Putaka doshas. So Basti Data dosha can be like Savata, Atidruta, Utshipta, Tiryaka, so many things are there. For example, if we consider the first, that is Savata, if the Uttar Basti is administered along with the air entry into the drug which has been administered or used, there will be colicky pain or udara vedana associated with that. Similarly, for Basti Netra, either very short or very long, Tanu, or if there is any Jina Shithila Bandhana, so there will be spillage of this material or to be used. Basti Putak also, if it is Visham or Mamsala, so the administration will not be able to be proper and the efficacy will not be as we are expecting from that. Now, this is a equipment named Spirit. This is an intrauterine insemination device for women, and this device minimizes the human skill factors in the procedure and standardization. Now, my point keeping this instrument Spirit here is, if this is an intrauterine insemination device, so why not this type of devices be innovated and be tried for administration of Uttarvasti, so that we can reduce the human error and we can standardize even the force and the pressure to be applied. Maybe it can be kept in 3 different speeds and settings as mild, moderate, and high. So that if I am saying that for a tubal blockage, it has to be high, the pressure and the force. So it will be standardized for everywhere to click into the 3rd knob or the 3rd bottom of the instrument. So it is very important and the need of the time to have some sort of devices which will help in standardizing even the instruments and equipments which are used in Uttarvasti. So with this, we will be continuing our next lecture with the pharmacological study of Uttarvasti. It has been done on animal model. The Uttarvasti has been tried and it has come out with very effective results. So please be with us so that we can get over to that. So with this words, thank you very much. Thank you.